open the teleconference line for questions from the media. Suite à la présentation, nous répondrons à vos questions. If you wish to ask a question, please press star 1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Procédons à la séance d'information technique. Let's begin today's technical briefing. Over to you, Dr. New.
Okay, thank you. Merci. Hello, everyone, and thank you for joining us at today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Major General Danny Fortin, Vice President of Operations and Logistics at the Public Health Agency of Canada. To assist us in answering your questions, we have with us Joël Paquette from Public Services and Procurement Canada. As of today, more than 14.5 million COVID-19 vaccine doses have been administered in Canada. As of last Saturday, more than 41% of the adult population in Canada has received one dose of the vaccine. Among people 80 years of age or older, 89% has received their first dose and 16% have received their second. And among people 70 to 79 years of age, 86% have received their first dose and 5% have received their second. In younger groups, 71% of those aged 60 to 69 years of age and 43% of those aged 50 to 59 years of age have received their first dose. As of April 30th, there have been 4,548 reports of adverse events following immunization. These include any medical event that occurs following immunization but isn't necessarily related to the vaccine. 748 of these reports, about 1 in 18,000 doses administered, were considered serious, such as a severe allergic reaction. As of May 6th, there have been 11 cases of blood clots with low platelets following receipt of AstraZeneca vaccine in Canada reported to the federal level. Sadly, 2 additional people from Alberta and New Brunswick, following the initial death reported in Quebec, have passed away. We offer our sincerest condolences to their loved ones. These adverse events remain rare, and this vaccine is providing protection to many Canadians. There has been a lot of discussion this week about the National Advisory Committee on Immunization, NACI, and its latest recommendation regarding viral vector and mRNA vaccines. The bottom line is, vaccines are essential to ending the pandemic, and the benefits of all vaccines approved in Canada outweigh the risks. They protect us from serious illness and death, along with the very real long-term impacts of COVID-19. I would like to take a moment to reiterate the respective roles of Health Canada, NACI, and the provinces and territories. Health Canada is the regulator that approves individual vaccines and authorizes their use in Canada. NACI, as a technical expert committee, makes recommendations on the use of these vaccines, including the identification of priority groups for vaccination. Provinces and territories then make the policy and rollout decisions about how to best deploy the vaccines in their jurisdictions based on their context and specific circumstances, such as the epidemiological situation. We can see in other countries that high vaccination coverage, together with the maintenance of strong public health measures, have led to decreasing infection, hospitalization, and death rates, and allowed for some easing of public health restrictions, such as in the UK, which has primarily administered millions of doses of the AstraZeneca vaccine to great success. In another development on the vaccine front, yesterday, Health Canada authorized the use of the Pfizer-BioNTech COVID-19 vaccine in children 12 to 15 years of age, after determining it's safe and effective in fighting COVID-19. This is the first COVID-19 vaccine authorized in Canada for use in children and marks a significant milestone in Canada's fight against the pandemic. As vaccine eligibility expands with each passing week, I encourage everyone to get ready for your turn. Check out the provincial or local public health website so you know where and when to register, make an appointment, or find a pop-up clinic. Ask people you know if they might need help booking their vaccination. Look for ways you can help your fellow Canadians have a more normal summer. Finally, as a reminder, we need to continue following public health measures like physical distancing, wearing a mask, and of course, getting vaccinated. Thank you. Bonjour à toutes et à tous, et merci de votre présence.
Good afternoon and welcome to this technical briefing on COVID-19 vaccinations. I am accompanied by Major General Denis Fortin, Vice President of Operations and Logistics at the Public Health Agency of Canada. To assist us in our question period, we have with us Joël Paquette from PSAC, the PSPC. As of today, more than 14.5 million COVID-19 vaccine doses have been administered in Canada. As of last Saturday, more than 41% of the adult population in Canada has received one dose of the vaccine. Among people 80 years of age and older, 89% have received their first dose and 16% their second. Among 70 to 79 years of age, 86% have received their first dose and 5% their second. In younger groups, 71% of those aged 60 to 69 and 43% of those aged 50 to 59 have received their first dose. As of April 30th, there have been 4,548 reports of adverse events following immunization. These include any medical event that occurs following immunization but isn't necessarily related to the vaccine. 748 of these reports, about 1 in 18,000 doses, were considered serious, such as a severe allergic reaction. As of May the 6th, there have been 10 cases of blood clots with low platelets following receipt of AstraZeneca vaccine in Canada reported to the federal level. Sadly, 2 additional people from Alberta and New Brunswick following the initial death reported in Quebec, and they have passed away. We offer our sincerest condolences to their loved ones. These adverse events remain rare, and this vaccine is providing protection to many Canadians. There has been a lot of discussion this week about the National Advisory Committee on Immunization, NACI, and its latest recommendations regarding viral vector and mRNA vaccines. The bottom line is, vaccines are essential to ending the pandemic, and the benefits of all vaccines approved in Canada outweigh the risks. They protect us from serious illness and death, along with the very real long-term impacts of COVID-19. I would like to take a moment to reiterate the respective roles of Health Canada, NACI, and the provinces and territories. Health Canada is the regulator that approves individual vaccines and authorizes their use in Canada. NACI, as a technical expert committee, makes recommendations on the use of these vaccines, including the identification of priority groups for vaccination. Provinces and territories then make the policy and roll out decisions about how to best deploy the vaccines in their jurisdictions based on their context and specific circumstances such as the epidemiological situation. We can see in other countries that high vaccination coverage, together with the maintenance of strong public health measures, have led to decreasing infection, hospitalization, and death rates, and allowed for some easing of public health restrictions, such as in the UK, which has primarily administered millions of doses of the AstraZeneca vaccine to great success. In another development on the vaccine front, yesterday, Health Canada, Pfizer COVID-19 vaccine in children 12 to 15 years of age, after determining that it is safe and effective in fighting the disease. This is the first COVID-19 vaccine authorized in Canada for use in children and marks a significant milestone in Canada's fight against the pandemic. As vaccine eligibility expands with each passing week, I encourage everyone to get ready for your turn. Check out your provincial or local public health website so you know where and when to register. Then make an appointment or find a pop-up clinic. Act Ask people you know if they might need help booking their vaccination. Look for ways you can help your fellow Canadians have. Finally, as a reminder, we need to continue following public health measures like physical distancing and wearing masks, and of course, being vaccinated. I will now invite Major General Fortin to deliver his remarks.
We have distributed over 18 million doses of COVID-19 vaccines to provinces and territories. Earlier this week, we received 2 million doses of Pfizer-BioNTech, the largest shipment from this manufacturer to date, and deliveries to provinces are now complete. As for Moderna, yesterday we received more than 1 million doses ahead of schedule. The shipment was originally set to arrive in country and distributed into next week. Deliveries to provinces and territories are underway, which will provide them with the opportunity to administer these doses into the coming days and into next week. Moving forward, we continue to expect weekly shipments of over 2 million doses from Pfizer-BioNTech over the course of this month, and over 2.4 million a week in June. For the week of May 17, we can expect to receive 1 million doses from Moderna, and we continue to work with Moderna to determine upcoming delivery schedules. We now have visibility for AstraZeneca doses from the COVAX facility. We can expect to receive 65,000 doses in the coming weeks using our contracted logistics service provider, FedEx and Omar. Additional detail will be shared on the shipment when it's available. And in closing, vaccine rollout continues with the sustained arrival of authorized vaccine into Canada. We have now reached that big lift period where weekly deliveries are more significant, and this should bring us to approximately 25 million doses by the end of May. Bon après-midi.
Good afternoon, everyone. To date, we have distributed over 18 million doses of COVID-19 vaccines to provinces and territories. Earlier this week, we received 2 million doses of Pfizer-BioNTech, the largest shipment from the manufacturer to date. Deliveries to provinces are now complete. As for Moderna, yesterday we received over 1 million doses ahead of schedule. The shipment originally set to arrive in country next week. Deliveries to the provinces and territories are underway, and they will be able to administer the doses next week. Moving forward, we continue to expect weekly shipments of over 2 million doses of Pfizer-BioNTech this month and 2.4 million doses a week in June. For the week of May 17th, we expect to receive 1 million doses of Moderna, and we continue to work with them to determine upcoming delivery schedules. We now have visibility for AstraZeneca doses from the COVAX facility. We can expect to receive 655,000 doses in the coming weeks using our contracted logistics services provider, FedEx, and Omar. Additional details will be shared on this shipment when it is available. In closing, the vaccine rollout continues with the sustained arrival of authorized vaccine into Canada. We now have reached the big lift period where weekly deliveries are more significant. And this should bring us to approximately 25 million doses by the end of May. Thank you.
We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking your questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question suivie. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. We will start with the first question. Première question, opérateur.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Mia Robson, the Canadian Press. Please go ahead. À vous la parole.
Yes, hi. I'm wondering if you, with those new doses of AstraZeneca that you're talking about coming from COVAX or any other doses coming, is there going to be a change in how they're distributed based on NACI's advice that places with low rates of infection might not want to use them? Are there provinces that are saying they don't want any more doses of AstraZeneca, or will this have any impact on how those doses are distributed?
Yeah, the plan at this time is to continue to distribute on a per capita basis to all provinces. The territories still have an ability to signal whether or not they want to receive those doses in the future. So we intend to continue with that approach. And at this time, we have not received indications from any jurisdiction, federal or provincial, that they would want to alter that distribution model at this time.
It's Dr. New. Maybe I can add to that. It's Dr. New. Certainly, based on the current recommendation for AstraZeneca as a two-dose regime, the thinking and planning is that obviously looking at the provincial sort of administration of the AstraZeneca vaccine, everyone who's received, that first dose, obviously, and that's great because they've obviously protected themselves, their families, loved ones, and even others in the community in terms of decreasing the risk of community transmission. But the thinking and planning is that the shipping of the AstraZeneca doses would be there to obviously offer that, quote, second dose of the two-dose regime.
Thank you for that. And I'm also wondering if you can just talk a little bit about this ramp up of both deliveries and vaccinations. Most provinces are now expanding their eligibility. Some are going right down to 12 years old. And it seems like there might be sort of this rush now to get appointments. Do we actually have the vaccines coming to vaccinate everybody down to the age of 12 with one dose by the end of June, as we hoped? Is that still, are we still getting enough vaccine to do that?
Well, we're definitely getting an increasing amount of vaccines. As I laid out, we expect to have 25 million by the end of this month. More coming in June, as I explained, with a very regular flow of Pfizer. More Mrna coming, AstraZeneca, and others. So I think if we look in the coming weeks and months, we'll have sufficient quantity of doses for provinces and territories to offer a vaccine to all those Canadians who want it, perhaps sooner than originally anticipated. But we keep a close eye on that. Provinces and territories keep a close eye on their throughput, and they're significantly increasing their ability to administer at scale, with new pharmacies being onboarded, with new modalities being put in place, drive-throughs, walk-in clinics. So the throughput is increasing across the board.
Yeah, it's Dr. New. Maybe I can add to that. I think it was, as I said in my opening remarks, I think a crucial milestone with Health Canada approving the use of the Pfizer-BioNTech vaccine for individuals aged 12 to 15. And you can see the provinces and territories, or at least several of them, are looking at that. Some of them have already announced in terms of eligibility and offering the vaccine to adolescents 12 to 15 years of age. So I think it's very optimistic. I think everywhere across the country, I think there's new energy and there's new optimism, as we're getting more vaccines, into the country, and then also provinces ramping up their vaccination efforts to, as they say, the overall national goal has always been to, vaccinate as many eligible Canadians as soon as possible. So I think we're on track, and I think it bodes well for the summer.
Merci beaucoup, Dr. New. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Raymond Filion de TVA. Please go ahead. À vous la parole.
Thank you and good afternoon. I would like to know if the 655,000 doses of AstraZeneca, you said they were to arrive over the next few weeks, but I'm wondering if they're going to come before the end of May. Well, we're still working with COVAX to finalize the details for the shipment. We are hoping to have the dates confirmed very soon. I can't give you an exact date right now, but it will be within the next few weeks, and as soon as we have the information, we will certainly communicate it. You have talked about an amount, I can't remember how much, for the end of May. So how many doses are we up to by the end of June? Can you tell us whether the goal of having enough vaccine to vaccinate Canadians, all Canadians, by the end of September, will that be brought up? Will it be sooner? Well, if I do some quick calculations, I think that we have at least another 15 million doses coming in June. What we don't have is the delivery details for AstraZeneca, Johnson & Johnson, and so on. So that would add to the amounts that I announced. So at the end of the second quarter, we will have received more than 40 million doses. So those are the figures we are working with right now. Can you tell us whether we are going to be able to do this more quickly than by September? Well, the goal is to give everyone both doses in Canada. I think it would be cautious to continue to say that adults and now adolescents will be able to be vaccinated by September. I think that Dr. New would agree. This is what we have announced, and we think we are going to meet those objectives. Thank you.
Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Kevin Gallagher de CTV National News. Please go ahead. À vous la parole.
Hi there. Thanks for taking my question. I just actually want to follow up on Mia Rabson's question from earlier where she asked if there were actually enough doses to vaccinate everybody by the end of June, if you're including this new cohort for Pfizer, right, for adolescents from 12 to 15. So, yeah, I am curious, when you're doing projections for how many doses we're trying to acquire and for how those doses will be distributed to the population, was the 12 to 15 cohort considered in, say, the projections that we've heard from Dr. Tam last week for getting 75% of, Canadians their first shot, for example, by a certain time. So I'm just curious as to know how that new cohort that's been approved now affects the numbers game for the doses that come in and how they're distributed.
It's Dr. New. Maybe I can start because obviously I was there with Dr. Tam for the the initial modeling and so on. And I would say that the modeling projections at that time certainly was based on what the current situation was at that point, and that it was basically a model using sort of the adult population eligible, because obviously the decision by Health Canada in terms of approving the Pfizer-BioNTech vaccine was only made yesterday. So just to answer that question, yes, the modeling, hopefully trying to reach 75% of eligible adults with at least one dose was based on the population of those over 18. Now with the 12 to 15, just doing sort of the calculations, I certainly turned over to Major General Fortin. But that would add about an additional 1.63 million individuals who fall into that category as part of our calculations in terms of the addition, obviously the doses required for Pfizer-BioNTech to offer those individuals that first dose. So I think I'll turn it over to Major General Fortin at this point. Thank you.
Thank you, Dr. New. I would simply add 1.63 million adolescents is less than a week's worth of Pfizer doses. So there will be sufficient vaccines in country to vaccinate earlier than initially anticipated with the first dose. All those Canadians who want to have it, it will be offered, and it's a matter of the provinces and territories executing that plan smoothly. And they've already shared some different timelines for meeting that objective. So I would defer to those individual provinces and territories to report on when they expect to have that cohort and the rest of the Canadian adult population vaccinated with a first dose.
Just to follow up on the AstraZeneca coming from the COVAX, with NACI's sort of recommendation that seemed to prioritize Pfizer and Mrna over AstraZeneca for some Canadians in certain hotspot regions, let's say, depending on where you are, I guess, whether you get AstraZeneca or preferably, right? I know that there's a certain stance on, take the first shot that's available, but is there now less of an effort to get the total COVAX doses? Is there going to be an issue with supply as well coming from India when we're talking about AstraZeneca moving forward?
It's Dr. New. I'm not sure. It's sort of maybe a two-part question. If you're looking at the supply logistics, certainly return it to Major General Danny Fortin and also Joël Paquette. But if you're looking in terms of the issue, and I think you're hinting at, is there maybe a less of a sort of a, what's the word, a demand or maybe some hesitancy for AstraZeneca? What I can say is that, what we said all along, the goal is to vaccinate as many Canadians as soon as possible with approved vaccines. And the 4 approved vaccines by Health Canada, certainly based on the clinical trials, were all shown to be effective in preventing serious illness and death. And that's been borne out in the real life, real world experience. If you're looking around the world in terms of those vaccines, all the vaccines being used, and the ones also here in Canada, we're still obviously waiting for the Janssen vaccine. But the 3 to date, I think, they've been very effective in preventing serious illness and death. And so I think, what Nasty said, just putting it sort of in context, is that they, from a technical point of view, in terms of an open, transparent, I would say a risk assessment, looking at the data to date, the fact that there's been a safety signal that's been sort of detected, and I think that actually is also credit to the very good, I would call it, post-marketing or surveillance systems, both here in Canada, in the U.S., and also in countries in Europe. Because of that, Health Canada did their job. They looked at the data. They looked at it along with other regulators, and based on that, overall, they concluded that the benefits still outweigh the risk, and what they've done is obviously adjusted the product monograph to make it clear. So in terms of informed decision making, that information is now part of the product monograph. Now, NACI actually also took a look at the data, and they came up with their technical recommendations. But as we all know, at the end of the day, it's the provinces and territories. They take all of that information from NACI and so on, look at their provincial context, epidemiology, and so on, look at the vaccines at their disposal, the tools in the toolbox to make the best use. Every vaccine has, obviously, it's certain advantages. For example, Janssen, maybe the one dose it makes it easier to vaccinate certain groups where it might be more difficult to give them their second dose. AstraZeneca, I think the refrigeration requirements are not as stringent as maybe the mRNA vaccines. That's all part of the mix that the provinces and territories look at. And so at the end of the day, I think Canadians can rest assured that, in whatever province or territory they're in, there's been thoughtful thinking by the chief medical officers of health and all the other folks involved in the planning the vaccination rollout in their jurisdiction. And so when they go to get their vaccine, the one that's offered to them is the right one. And I think the other point, of course, is that with the information out there, we all recognize that information is important, and that has to be a good informed consent so that everyone feels comfortable in terms of the decision they make regarding the vaccine to receive. So hopefully that helps in terms of the context of NACI, provinces, territories, and Health Canada. And for the supply logistical aspects, I'll pass it on to my colleagues. Thank you.
Thank you for Dr. New. For the AstraZeneca, we have a advanced purchase agreement with them for 20 million doses. We've received 1.5 million through an exchange with the United States. We're continuing to have discussions with the United States for a possible further exchange. We're also expecting 1 million doses through that particular agreement starting in June. We have 2 million doses through the Serum Institute of India, of which we've received 500,000, and we're expecting 1.5 million more. And we're working with the Serum Institute to determine when that will receive those doses. And we've received over 300,000 doses from COVAX, and we're expecting another 655,000 before the end of this month. So all in all, we're getting quite a bit of AstraZeneca doses that will be able to administer to Canadians. Thank you.
Thank you. Next question.
Thank you. Merci. The next question is from La prochaine question est de Mylène Crête de Le Devoir. Please go ahead. À vous la parole.
Good afternoon. I would like to know when you expect the decision to authorize Mrna for adolescents between the ages of 12 and 15.
Moi, je vais répondre.
This is Dr. New. I will answer that question. We know that there are a number of applications and clinical trials underway, and it is really in the hands of our colleagues at Health Canada to make that decision, and then it is after the application from each company that they do the analyses, and then they will perhaps give their authorization. So that is the situation right now. I was wondering also whether we can hope to be able to vaccinate children under the age of 12, perhaps even by September when school starts again. Dr. New again. Thank you. That's a similar question, and I appreciate it. There are a number of ongoing clinical trials for children even under the age of 12. So we need to wait for those results and have the evidence, and then those applications will go through the regulatory process, as it does in other countries. And in Canada, Health Canada has that responsibility and may give that approval, but it is too soon right now to know exactly what will happen. We have to wait for the results from those clinical trials and then see whether the companies want to apply to Health Canada. Thank you.
Thank you. Merci. The next question is from La prochaine question est de Ryan Tumulty, National Post. Please go ahead. À vous la parole.
Yeah, hi there. I'm wondering what sort of measures you're putting in place with the Pfizer deliveries coming so heavy now and so many Canadians getting Pfizer for their first dose. I know there's the potential of mixing and matching, but I know those studies aren't done. So what sort of measures are you taking in place to ensure that Pfizer will be available for someone's second dose? Is there going to be a point at which you recommend to provinces to stop offering it to people for their first dose?
I'm not sure I start. I don't know. It's thank you very much. An interesting question. Obviously it's a logistical one. Certainly from a public health perspective, what I can say is that the Pfizer-BioNTech vaccine is the only one approved for adolescents at 12 to 15. As Major General Fortin said, that's not really that many, Canadians. That's 1.63 million, and he pointed out that's sort of like a week's worth or so of vaccine doses. So based on that, and also sort of the anticipated, but also to date, the very sort of stable delivery of the weekly shipments of Pfizer-BioNTech, I think the provinces are taking into account, and the fact that as part of their planning, you could see several provinces have already opened up the eligibility to even offer it to individuals 12 to 15 years of age. I can't speak for the provinces and territories, but it appears that that's in hand in terms of obviously the logistical aspects and the planning for the vaccination programs. But I think I'll turn it over, obviously, to Major General Fortin and maybe Joël Paquette, if you would like to add something as well.
Yeah, what I would tell you is provinces and territories have a good handle on what they need, and they keep tabs on who's getting which vaccine. And in the discussions that we're having very regularly, of course, we're probably only starting to do deliberate planning on second doses. I mean, there are provinces that are booking appointments for second doses. Others, they will book that a little bit later as they go through, as they move forward. but they keep tabs. They are hard at it, ensuring that we have the right doses for the right people. So in our conversations, this would come up. When can we expect to have AstraZeneca? When can we expect to have Moderna? And they build their plans around that, and we continue to work to provide them as much visibility as possible on that. So I think at this time, everybody's working on a very deliberate plan, making sure that the people get the right vaccine when they're supposed to receive it.
Maybe I can just ask this question a different way for better clarity, because I know it's a complicated issue. But my understanding is we have a contract for about 44 million doses of the Pfizer vaccine to arrive before September. I know they're arriving at a much faster rate than any of our other vaccines. I'm wondering if you're going to tell the provinces once we clear the halfway point, I guess, 22 million, to hold on to the other doses for second doses, rather than have sort of a situation where we'd, give too many Pfizer doses as first doses and not have enough for the second ones.
Merci. Prochaine question.
Yeah, I'm sorry. It's a doctor. Maybe I'll attempt to answer that. You're right. It's maybe it's myself not answer, maybe understanding the question, but I think the strategy in Canada to date overall has been to vaccinate as many Canadians as possible with that one dose strategy, and based on sort of the best, latest, obviously data available in terms of stretching the dose interval up to, but it doesn't have to be up to 4 months, and certainly based on the scheduled delivery and the fact that we're getting many more millions of doses of Pfizer into the country, I think from what I understand from the provinces and territories that they have the planning in hand to offer everyone sort of the first doses, and I guess anticipating that obviously based on the regular scheduling, that it's not about holding back doses. I think we all want to get, as they say, vaccines into arms as soon as possible. So the fact that they've opened up several provinces the eligibility to adolescents as well, I think it's part of that strategy to vaccinate as many Canadians who are eligible to get that first dose, and then obviously then going with the second dose. So I don't think it's part of the thinking planning that they're going to hold back doses. I think it's all about getting as many Canadians as possible vaccinated with the first dose, and certainly based on what planning's been done to date and the actual stability of the shipments from Pfizer, I think it's in hand in terms of being able to provide the Canadians then with their second dose. I'm not sure, is that what you were looking for?
Yeah, that's it.
Okay.
Thank you, Dr. New. Prochaine question.
Thank you. Merci. Once again, please press star 1 if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. The next question is from, la prochaine question est de Tom Perry, CBC News. Please go ahead, à vous la parole.
Hello, thanks for taking our questions. Dr. New, I'd like to ask you a question about vaccine passports. Quebec announced today that it's going to be rolling out a digital proof of vaccination with a QR code attached to it. I'm wondering if you think this should be a model that other provinces might follow.
It's interesting. Thank you very much for the question. So when we're talking about, I think, vaccine certificates, vaccine passports, certainly my thinking, I think also with others at the agency in working even internationally, is that we separate in terms of what it might mean in terms of crossing international borders. And I think if you're fine, we won't go there. Obviously, lots of thinking, lots of discussion happening in terms of the requirements in terms of traveling abroad. What would happen in terms of sort of standardization. Lots of issues to work through. Obviously, one of the issues I think it applies as well domestically is I think that the issue of equity, right? Obviously, many countries probably are not able to vaccinate their populations, as quickly or to the same degree as Canada. Where we're lucky here. So with that, requiring citizens of one country to have a vaccine passport to be able to travel to another country and so on. That's something I think that's also looked at. So I would say in that space, the quicker and the more rapidly we can provide equitable access to vaccines around the world to citizens everywhere, I think is important. We're not none of us are protected till all of us are protected. So I think that's an important principle to keep in mind. Domestically, certainly what you mentioned in terms of Quebec and what they're doing. Yes, I think that's something that is I think being looked at in obviously several jurisdictions. We're also obviously quite engaged at the federal level. But as I mentioned before at previous press conferences, there are lots of issues to look at, in terms of what does that mean? What are sort of the uses of someone having a certificate or sort of an indication that they've been vaccinated, hopefully, like I say, quite soon with the 2 doses. In terms of equity, stigma, discrimination, I would say even from a pure technical scientific point of view, if we're also obviously still worried or concerned about ongoing community transmission, we have to keep in mind that you have to maintain the public health measures. It's not vaccination alone that's going to get us out of this. And to that point, then, the fact is that we still don't know in terms of long-lasting or what the duration of immunity is. So someone might get their 2 doses, have a certificate. Well, what does it mean, 6 months from now, a year from now, and so on and so forth. And the fact is that we know no vaccine is 100% effective. And so, the fact is that there are people going to be walking around having maybe received the full 2-dose regimen, let's say, for the vaccines that require our 2 doses, that may still be susceptible to COVID-19 and then also be able to transmit to others. So even technically, there are some obviously some scientific issues to look at. And then, of course, as I said, the ethical and all those other things are also something that needs to be looked at as well. Thank you.
And just as a follow-up, can I just double check? I heard there was some talk earlier about U.S. doses or potential U.S. doses of AstraZeneca. I heard someone reference 1 million doses in June. I assume that's from the Serum Institute in India that we're talking about. Is there any further update on us potentially borrowing more AstraZeneca doses from the United States anytime soon?
Thank you for the question. What I was referring to was our 20 million advance purchase agreement with AstraZeneca, and we are still working with the United States on a potential exchange. And the 1 million would be through our APA with AstraZeneca. So the 1 million in June is that, not the Serum Institute of India.
Okay, thank you.
Thank you.
Thank you. Next question.
Thank you. Merci. The next question is from La prochaine question est de Mark Villani from CTV News Calgary. Please go ahead. À vous la parole.
Hi there. Thanks for taking my question. The Prime Minister talked with Alberta Premier Jason Kenney and both Calgary and Edmonton mayors recently, saying that the feds are willing to assist as we experience the highest case numbers per capita in North America here in the province of Alberta. Wondering if we will see increased shipments of vaccine doses to Alberta as a result, especially as we have just expanded vaccinations to that millennial group.
It's Dr. New. Maybe I can start, and then Major General Fortin can add. Yeah, certainly the situation in Alberta is quite serious. I think, as you pointed out, that they have a very, very high infection rates. Their healthcare system is obviously beginning to be overloaded and so on. But as I've said previously, vaccines alone are not the silver bullet. It's not what's going to get us out of the situation. Even if you were to give a vaccine to an individual, it takes several weeks for immunity to develop and so on and so forth. And so we all recognize that really what's needed at the present time is strong public health measures, both in terms of individual behaviors, the wearing of the face mask, not mixing with others outside of your household, good hand hygiene, and so on. We all know that. And beyond that, obviously, governments, I think, have a role to play, because at the population level, even if someone is well-meaning and wants to do all the right things in terms of, the physical distancing and the face mask, and so on. As we all know, some essential workers, based on their circumstances, it's not easy. You can't take a day off work. You don't have maybe the social supports, the sick days and so on. So I think those are things that also need to be looked at in terms of providing supports for essential workers and others who are not able to follow all of the good sort of personal public health measures that they would like to. Other than that, like I say, there's always that delay aspect in terms of when you implement strong public health measures or even vaccination, it'll take a few weeks after that to actually see any impact. So right now, I would say that most of the support that maybe Alberta might be requiring are things that might be more maybe equipment or sort of things related to the healthcare system. But I would say that as the federal government, I can't speak for the whole range of supports, but certainly we're always open to listen to any request, and then we'll obviously get into the details and see what we can do in terms of any type of support and assistance that the federal government could provide to the province of Alberta. And with that, maybe I'll turn it over to Major General Fortin.
Yes, thank you. Maybe just a quick comment. Over the last several weeks, we saw numbers increase with Pfizer and Mrna and others, and so there were discussions through various tables, and we solicited the input of provinces and territories, the Special Advisory Committee on COVID, for instance, and the CIC Immunization Committee, and for a number of reasons, looking at hotspots in different locations in the country, and more to come. The decision was made for every vaccine to continue with a per capita distribution on a per capita basis. We revisited that with more Mrna, and that was the decision that was made in the end. We revisited that with Johnson & Johnson, and the same decision. We came to the same decision. For a number of reasons, we don't have a federal reserve that we can tap into to cover on short notice a particular area, Alberta or another jurisdiction. We don't want to hold on to doses for that eventuality. We want to push those doses out to provinces and territories for those jurisdictions to administer those doses. So the best way we can help at this time without taking from one province to give to another is to continue on pace and produce as much or provide as much clarity as possible to provinces and territories so they can plan, make adjustments. And Alberta has been making huge adjustments to its distribution with the number of vaccines, with the number of pharmacies onboarded starting this week, tripled from the previous week, and various other modalities are expanding.
Follow up, Mark?
No, thank you very much.
Parfait, merci. That will be all for today's technical briefing. C'est ce qui m'est fait au brefage technique pour aujourd'hui. Merci beaucoup d'avoir été avec nous et bonne soirée.